Everybody, it's Dr. Eric Balcavage. We're back for another edition of the Thyroid Answers podcast. And with me is Kara Siedman. She is a registered dietitian and she's a certified diabetes care and education specialist. She'll tell us what the heck that means. But one of the things that she is really into and very knowledgeable about is the microbiome. And we're going to get into a discussion of the microbiome. We'll kind of talk about how this relates to our overall health, physiology, and of course, we'll talk about the impact on thyroid physiology. So Kara, welcome to the Thyroid Answers podcast.
Yeah, thank you so much for having me.
And Kara, I got to be honest to the audience. This is not our first conversation together, is it?
No, we're old friends.
So just so everybody knows, we had a fantastic conversation about a week ago, loaded with fantastic content. And then when we finished, somebody didn't have the record button on, and that would be me. And so we are back. We're going to have her back again. I promise we'll do just as good of a job as we did the first time. But yeah, we had a fantastic conversation, and there was no way I was going to let this conversation go unheard. So Kara, welcome back. Can you just give everybody an idea who the heck Kara is and why we should listen to her?
I love that question. So yeah, you said I'm a registered dietitian and been practicing and in this space for over 15 years now, and came through very conventionally. You know, I as most dietitians do, worked in the hospital and, you know, really kind of fed my love for just medicine and healthcare and acute care. But of course that translated, I've always been into more natural medicine, translated into more counseling, really wanted to help people with more long-term sustainability, and found myself working in various demographics. I started a diabetes program, and then made my way to Colorado and got connected with a very large gastroenterology practice that, you know, very allopathic, conventional scoping, and kind of didn't know what dietitians would do. And here I come and sort of started this functional integrative nutrition program for them and was with them for almost 8 years. And that's really what I think. I've always had this interest in the microbiome. I'm a food fermenter, got into that very early on in my college days, but just sort of fed my love for working within the GI tract, the world within, which is our microbes. And we know that this has such a valuable impact and such an incredible impact on our overall health. And so I used to tell the doctors I worked with, you know, you guys know the GI tract, and then I work with the bugs within. And so it was a nice relationship, and that kind of propelled me into the microbiome space, working for various companies, biotech companies, and really just my love for science, and science specifically related to the microbiome, which is such an evolving field and continues to evolve, and it's a really exciting field.
So why did they hire you? For the first, I mean, not that
I know,
nothing against you.
No.
Yeah, I mean, because if you have a traditional gastro office, how often are they going, maybe we should be working with this person's nutrition? Or
yeah, no, it's a great question. One that I asked them in my interviews. So they were, you know, it was a privately owned practice with multiple offices, and, you know, kind of on the business side wanted to bring everything in-house, but I think they really only wanted me for educating on celiac disease and a gluten-free diet. And lo and behold, here I come, you know, being like, well, I can do so much more. So I put in a lot of education. I would sit with all the doctors. I would do weekly, monthly education sessions on what we can do as dietitians beyond even just the nutrition space, but what we can do to help patients not just feel better, but can even overcome some of the things that they were dealing with. And so it took a while. I would say it took a good year of not just working with patients, but really building that trust. And then it really grew. I had, you know, 4 other dietitians that I trained and mentored, bringing in supplements and integrative therapies, bringing in other sort of functional lab testing. I still don't think they really knew all that we did, but the patients were feeling better, and people were, you know, gaining back so much of their quality of life that they were like, okay, this is working.
So did they understand, especially from a functional medicine perspective, when we look at GI testing, they're looking at pathology, right?
Yeah.
What do I have to cut out? What do I have to medicate?
Yeah.
Versus in functional medicine, we're often looking at, is there dysfunction in here first, right? And we may see somebody who comes in with gas, bloating, constipation, diarrhea. They do their endoscopy, the colonoscopy, they do their testing and they go, there's no pathology here.
Yep.
Right.
Structurally, biochemically, you're okay.
Right.
Yep.
They may even note there's some erythema and inflammation,
Yep.
but essentially normal.
Yep.
Right.
Yep.
So how open were they to this idea that maybe that the disease is coming from longer term altered function or dysfunction long before the pathology actually shows up? Were they open to that, or did that take some work?
Some were and understood that process, but I think there's a big difference between a gastroenterologist that's looking at structural
Mm-hmm.
issues, right? Looking at things that you can see. And that's why I love the relationship. Everyone coming to me, I knew they didn't have, or they did have, IBD or celiac. We got a lot of that differential diagnosis ruled out. And then I think, there's definitely a disconnect, I think, between the sort of conventional gastroenterology world and then the microbiome space. And I think we're going to soon see that you're going to have gastroenterologists and you're going to have microbiome doctors because they are very different. I think there was a disconnect. I think when educating on the research, there were people who were, especially some of the physicians that were coming around to, yes, there's something happening that's driving this. And even more so, these sort of traditional, conventional organizations like the Rome Foundation have redefined the term functional GI disorders and have even renamed them to disorders of gut-brain interaction. So this, I think the conventional sort of allopathic world lags behind the sort of functional space. The functional integrative space has always looked beyond just the system that's being impacted. But we still have a long way to go. And I think that's why we have various practitioners. It was a wonderful relationship in being able to make sure that some of these biggies and the big things were ruled out, but then patients would come to me, my clients would come to me, and they're disappointed. I mean, that was one of the most interesting things working in the GI space is how upset patients were that they didn't have a diagnosis. I just saw a patient the other day that said that to me. I'm frustrated and upset that I was almost hoping for something to show up. I mean, that's so twisted, right? Like that they want a diagnosis. And I think that that's really leaning into what we do in the integrative and functional space and where sort of the microbiome space has taken us, and that no, there is actually something wrong. We just can't see it to the naked eye, but there is something there, and we understand that.
Yeah, I think it's because we all grew up watching TV, right? And so because we all grew up watching TV and commercials, we feel that we need a diagnosis to treat, right?
Yeah.
And if you don't have a diagnosis, then insurance doesn't cover it. There's nothing wrong with you. But it's different from a functional medicine standpoint. I mean, you often hear people saying from a functional medicine space, we don't diagnose, right? The reality is everybody diagnoses to some degree, right? We're saying, hey, you have low stomach acid, but it is a different model, typically from a functional perspective from what they're doing. But
I like to say it's integrated, right? Like we're looking at how each system impacts other systems. And that's what I love about the microbiome. I work for a company that's really working in microbiome research. We call it the gut X axis. And this sort of understanding of at the foundational level, how are each of these systems, and specifically the microbiome, but how are each of these systems impacting beyond? And I think as integrative functional practitioners, we're looking at the entire system. We're not just looking at the heart, the lungs, the liver, right? And I think that that's an important piece because we know everything is interconnected. And I often think of the microbiome kind of as that hub, as that foundation.
Yeah. Let's talk about what the microbiome is, because some people may not know actually what you're even talking about when you're saying the microbiome. What is the microbiome?
So we'll often hear two different terms, microbiota and microbiome, and these are often used interchangeably, but there are some subtle differences. So I'll first say the microbiota. This refers to the collection of microorganisms, from bacteria to fungi to viruses, that all live within a specific environment. So we'll think of microbiota that live on the skin, microbiota that live within the gut. And so then the microbiome encompasses not only those microorganisms like bacteria themselves, but their genomes, their genes, the surrounding environment. And so I think of the microbiota as like the individual residents And then the microbiome is the neighborhood. So you have a
Mhm.
gut microbiome, you have a skin microbiome, we have an eye microbiome. I mean, we're essentially finding these various microbiomes in all parts of the body. We really, blood, urine, like all these areas that we thought were sterile, the lungs, which has really been kind of at the forefront of some of the newer microbiome research, that we have these unique and individual microbiomes, and there's this crosstalk that exists between all of them. And the gut microbiome is that largest neighborhood. It's the biggest neighborhood. It contains the most bacteria. And so when we talk about the microbiome, we are often talking about the gut microbiome.
And they're all interconnected to some degree, right?
All interconnected, yeah.
For the listener, like it is believed that, so for a mom during pregnancy, like how does that child develop a microbiome, right? Well, because some of that, and you can correct me if I'm wrong, but some of that flora gets transported, and it's to some degree, it's our own immune cells that are helping transport the bacteria or or some of these microorganisms into the vaginal area to
Yep.
colonize it, right? So it is not that these are disconnected systems, they are all interconnected.
All interconnected. And exactly, the sort of first seeding that takes place from mother to child is through that vaginal canal. And so, there's an incredible influence. And each of these microbiomes have now really been relayed back to, especially the gut microbiome, to almost all chronic conditions. There is not a condition now that doesn't have some sort of crosstalk or conversation that's occurring between the gut and these other organ systems.
Yeah. So I think it was maybe a decade or so ago. Um, I heard, I think Mark Houston, who's a cardiovascular
Mhm.
doctor, say to become a good cardiovascular surgeon, I had to become a gastroenterologist,
Yeah,
right?
yeah,
Because
exactly.
he fully realized the impact of GI based issues having an impact on the cardiovascular system, creating inflammation, creating damage to the cardiovascular system,
Yep.
which was amazing to hear from a traditionally
Yeah.
allopathic
Hmm.
surgeon to tie these two different systems together and go, hey, this is a big piece. So pretty important. And now today, I mean, you could see a lot of clinical research where you look at somebody's microbiota in their GI tract, and you can look at literature and see, okay, these in certain conditions, we often see these types of bacteria high or low,
Yep. I
right?
think that's exciting in the microbiome space,
Mm-hmm.
is really understanding these, what we call profiles or microbial signatures that
Mm-hmm.
are very common with specific conditions. So we can't diagnose based on microbes, but this is potentially an insight and a new frontier when it comes to, well, people that have COPD have this sort of microbial signature or profile. People that are obese or suffer from type 2 diabetes have this type of microbial signature. And I think this is the movement of the future. And when we start to get into precision medicine or precision conversations, we have to start to consider the microbiota. And with advancements in DNA technology, we're getting there and better understanding these microbes that are more prevalent or common when it comes to certain conditions. And so I think it's a cool space. I think MD might change down the road and it might be a microbiome doctor now.
Mm-hmm.
But I think you can't really specialize in one area and not have an understanding of how the gut and the gut microbiome is impacting it.
So this is gonna be a two-part question. We'll take them one at a time, but we'll get them both out at the same point. Have we established what a healthy microbiome even is? And two, how do we go about evaluating the microbiome appropriately?
Yeah, great question. And there was some newer research that came out last year of like this very question: what is a healthy gut microbiome? And there really isn't this perfect consortium of bacteria or understanding of you must have this or you must have that. There are characteristics. And so I'll kind of take us through those characteristics. And one of those characteristics being diversity. We talk about diversity both in quantity of bacteria, and we're going to talk about bacteria primarily just because that's the largest, microbiota that inhabit the microbiome, the gut microbiome, but you've got quantity and then you have the quality. And there's definitely some varying opinions on that. But when we look at sort of indigenous tribes, when we look at, and various indigenous tribes that we sort of use as a marker, they've got lots of different species. They can have sometimes upwards to, 500 to 1,000 different species of bacteria. And as we've industrialized, as we've moved into our sort of modern world, that number has gone down. And when we see with different sort of microbiome tests in clinical research, also what's available commercially, I'll see patients and people that have 12 species, 50 species. So that sheer number has just gone down. And that's kind of an understanding of like, okay, something's changed, but more specifically, we're losing the diversity of our good bugs, the good bacteria, your health promoting bacteria, or what we call these keystone species that really have an influential impact on the overall health, primarily your short chain fatty acid producing bacteria, short chain fatty acids being those very important metabolites or chemical signals that really impact just about every aspect of the body, play a huge role in reducing inflammation, supporting immune responses, brain, heart, lungs, all of that. And I'm sure we'll get more into short chain fatty acids. But as we start to lose that abundance, so a healthy microbiome is going to have diversity of these health promoting species. A healthy microbiome is also going to have a supportive gut barrier. And so when we talk about the gut barrier or the mucosal barrier, we'll hear that term a lot. I simplify it to say it's your security perimeter, it's your fence. I always look at my backyard because I have a fence. And so I keep everything inside my fence that I want in there, like my dog or my garden. But those individual fence posts, or what we call those tight junctions, that keeps everything sort of tight. We want to make sure that we have well-formed tight junctions, that they're in place, because that protects your immune system. And so if you have a supportive gut barrier, if you have this supportive fence, then what's in the microbiome can stay in the microbiome. And it's porous, right? So nutrients can come through that we need to, but it's keeping out the things that we don't want to get into our immune system. So when we think of a healthy microbiome, we're having those key pieces in place. We don't have a lot of pathogenic bacteria or bacteria that can promote inflammatory responses. And we're really supporting that gut barrier. Whereas an unhealthy microbiome, you start to see that change, right? You start to see that loss of diversity. You lose those key health promoting species. You start to see your fence posts get knocked out. And then that's where unwanted bacteria or components of bacteria can then get into systemic circulation or your bloodstream and start to drive changes throughout the body, which we'll talk about. Yeah. So that's kind of like, in the sense, I think of it as more of these sort of characteristics, but we are getting closer to understanding more of that sort of population of what we really want to inhabit or exist within the microbiome.
So do we, because there's so many food religions today, and a lot of people swear that when they changed their diet, that their health got so much better. Have we established that a healthy vegan diet is going to have this type of a biome versus a carnivore diet? That's a healthy person on a carnivore diet is going to have this type of biome. The person on a healthy, and I keep saying healthy because you can have unhealthy of all of these, right? A person on a healthy ketogenic diet is going to have this type of kind of profile. Do we know any of that yet, or is it too early?
So there is some really good quality research that's coming out around diet. I think diet is, and there are some big sort of microbiome researchers that are really trying to figure this out, of kind of the personalized diet. Like, can we eat for our microbiome? And I think that's a movement of the future. I hope to be alive when that gets figured out. But we have seen what some of these dietary changes can do to the microbiome. Now, the microbiome is malleable, right? It can change very quickly, but long-term sustainable change takes time. So you can eat really well during the week, go hog wild on the weekend, and have a different looking microbiome, but then it can sort of bounce back to whatever your sort of stable state is. So to create meaningful change, we need to have, I always say minimum 8 weeks, but longer to really start to see that shift, especially depending on how, damaged or dysbiotic or imbalanced our gut microbiome is. But we have seen research. So I'll give an example, right? And I just was like listening to a video of the person who started the carnivore diet. This is not a diet, that I personally prescribe to, and nor do I see people that come in and are like, I eat this way and I feel amazing. I'm not working with people that feel amazing, unfortunately. I wish, right? Our
Hmm.
job would be a lot easier. um, but there has been some interesting things that have come out, and actually the person who started the carnivore diet stopped. He doesn't prescribe to it because he started developing all these symptoms, from fatigue to hormone imbalance to gut issues, all this stuff. And so what we do see is there are certain types of foods and certain components of foods that nourish and feed our gut microbiome, and specifically our fiber, our complex carbohydrates, your prebiotic fibers. So when you
Hmm.
strip the diet of these very important components and you start loading up with a lot of protein, which is essential. We have three macronutrient groups, I say: protein, fat, and carbs. They're all needed. So when we go on these sort of extreme plans, we start to remove those substrates or the food that our bacteria prefer. And that can start to shift the abundance of the types of bacteria. And so people that have a lot of pathogenic bacteria, more dysbiosis, or just an imbalance between your beneficial bugs, right? Everyone's competing for nutrients. Well, when you have a lot of protein, that's essentially what's going to get fermented or broken down by your bacteria, and it can actually produce byproducts that can be more harmful and be more toxic. Or even, like, I love using the sort of understanding around saturated fat. There's a lot of conversation in the nutrition realm around saturated fat, and specifically coconut oil. I remember when it was like, oh, you broke your arm, put some coconut oil on it and you'll magically feel better. But this actually induces more sort of what we call endotoxemia, or more of these sort of unhealthy components, specifically lipopolysaccharides, to get into circulation. It has a more endotoxemic effect. So I really look at the individual, right? What do you have going on? What are your issues? We can sort of think of the microbiome of how we have to start to create balance, especially with the diet that someone's coming in on already. And so I think balance is key. As a dietitian, I very much promote that. But I am a huge proponent, and the research points to this, is that we have to make sure that we're including a robust amount of our beneficial fibers, our prebiotic fibers, because we know that feeds your beneficial bacteria. We know that's how we can encourage the survival and the thriving of your commensal species.
Yeah, and we'll get into that
Yeah.
in a little bit in more detail, because that part's important, and we'll talk about the barrier and
Hmm.
um, the analogy of the fence post and those things is really good. I almost kind of think about it too, and I guess I'm dating myself here when I say it. Sometimes that there's almost like the DMZ, if you know what the demilitarized zone is, right? Between these cells and the gut lumen, we've got this kind of mucal layer there that's like, hey,
Stay
don't come
out.
in. Yeah, don't come in here. So we can get into that in a little
Yeah.
bit. But so we know that there's, food can change, definitely has an impact on the microbiome. Um, what else has the science shown us really can change the
Yeah.
microbiome for good or bad? And maybe take the good first, or start with the bad
I'm gonna
first
start
and
with
end with the good,
I'm going to
whatever.
start with the bad, because it can
Yeah.
be kind of depressing, right? When we
Yep.
think about, and actually it's a term, it's called the exposome, which I
Hmm.
think is a cool term, um, because it's not a good thing, right? It's all these external, or in the cardiovascular, we call it modifiable risk factors, right? Or
Hmm.
dysbiosis risk factors. I call them the earthquakes and hurricanes and bomb cyclones that, disrupt your foundation, since I think of the microbiome as the
Yeah.
foundation to a home.
I just had like the visual of a whole bunch of people dressed up like furries going to some like Comic-Con or something when you said X, when you said
Right.
it. I was like, huh, okay. But go ahead.
Exactly, right. We
Yeah.
can envision all this. But basically, all of these external factors that we know are creating imbalance or dysbiosis or damage to the gut microbiome. And so, obviously, diet being one, ultra processed foods, right? Not consuming these beneficial foods that we know are really important for the microbiome. And there's been a lot of research that has come out around ultra processed foods, actually, in the last year or two, that talks a lot about the combination of these different emulsifiers and preservatives, and how it actually knocks your fence posts out and breaks down that mucosal or that gut barrier. Medications, right? Antibiotics. That's probably the number one thing when you look at the research and what's been studied. Antibiotics just kind of decimate, right? They're like a nuclear bomb when it comes to the microbiome, and they're needed. The problem is we throw antibiotics at everything, and that's a very common practice. We don't know what's wrong, take an antibiotic. There's been a lot of research to show that, certain number of antibiotics before the age of 2, you have an exponential increase in allergies and obesity.
Hmm.
And so antibiotics are a big part of this. Certain medications like proton pump inhibitors, which we know many people take for things like reflux and Barrett's, that suppress and really stop your parietal, the cells in your stomach, to produce stomach acid. We need stomach acid. It neutralizes
Hmm.
pathogenic bacteria. It helps with the breakdown of food. So that's another sort of medication. Chronic stress. And I say that, with a lot of empathy, because who doesn't have stress, right? And I always kind of cringed when I'd hear even the providers that I worked with, that's like, oh, you just got to get rid of the stress. Well, everyone has stress. It's the way the stress impacts us, how we deal
Hmm.
with it, how we let it sort of marinate into all aspects of our lives and our body, that it really creates a lot of dysfunction. Um, Even travel, I travel a lot for work. Those changes in your circadian rhythm can impact the microbiome. And so, we start environmental toxins. So all these things that are coming in that are around us that are starting to create sort of this change in this imbalance where we start to see this sort of downstream effect. And not to be all like doom and gloom, because we do live in a modern world, but small changes can actually have very significant impact. And from changes to the environment, getting rid of some of those environmental toxins, to the types of foods that we choose, we know that even this is a whole nother conversation that we could probably have a whole nother podcast on, organic versus non-organic. But there's been a lot of studies now looking at the impact of glyphosate,
Hmm.
and even more, not even just glyphosate, but Roundup, which is primarily used, and the damage that that does to the gut microbiome.
Right.
So, from a nutritional quality, there's not that really necessarily much difference. But in terms of what those chemicals and those environmental factors or those environmental impact inputs are doing. And so I think we can make some of these small changes. I kind of look at my life and say, well, this is something I can't quite change now. So what could be something that's easier for me to remove or replace for something that's beneficial? And I think that that's a way to not make it so depressing.
So before we get into the goods,
Yeah.
right, the good stuff, I
Hmm.
think, and I haven't delved into this too much, but you may know a little bit more about this. I totally agree that it's important, like what we often spray on our food as a way to have nicer looking crops, right? And they grow better, can have a negative impact on our gut-based physiology because of the way those chemicals impact us. You were talking about glyphosate, and we were told for decades that glyphosate doesn't create a problem because we don't have a Shikimate pathway and only the
Yes,
bacteria do, but our bacteria have a Shikimate pathway, right? So
exactly.
it can destroy our gut flora. And maybe this was a bigger trigger for things like celiac disease and gluten reactivity than
Hmm.
the actual wheat itself that we've potentially been eating for thousands of
100%.
years. And so there's this big push, and especially right now, and I've got concern when we start to look at this from what they're pushing for is these more toxic chemicals that we put on the food and saying, hey, we need organic stuff. But I have a concern about some of the things that we're saying are organic may not be very healthy for us either. And this
Yeah.
kind of goes to the BPA like plastics are bad, so we're going to change it. And they're still BPA like plastics. We just changed the name. So are you seeing in your literature, I think you've already alluded to the fact that some of the things that we spray on our foods can create some problems for the gut biome that are maybe not organic, but are you seeing things that we spray on the food and people think, oh, this is organic because they use organic pesticides and organic fertilizers, so it must be good for me and my biome? Are you seeing information that maybe some of these organic things aren't very healthy for our gut flora?
Absolutely. I think this is like such a complicated topic. And I just want to first say, like, yes, these sort of chemicals and what we're spraying, we know can damage the gut microbiome, but does eating that then whole grain and that, berry sort of counteract some of that damage? Potentially so. So I
Mm-hmm.
mean, I think we can become very fearful around food. As a dietitian, I've definitely experienced this. I live in Colorado. Like Boulder is where orthorexia, sort of got coined, and this sort of, overly healthy or this sort of fear of eating unhealthy food. And I think we have to take it kind of from a larger perspective that we know when it comes to good nutrition, which is the most important thing when it comes to the microbiome.
Mm-hmm.
Outside of like probiotics and all the other stuff and the noise out there, your diet is the number one sort of modifier or impact from a good and a bad perspective.
Mm-hmm.
So I don't really encourage organic this or organic that. I might say, hey, certain things that we know are more highly sprayed, you might want to choose, but it is more important that we're consuming these fiber-rich foods. It's more important that we're consuming these prebiotics because organic or not, we know those have a beneficial impact. And so I think that's a way to like just kind of, again, we're speaking from an educational, from a science
Mm-hmm.
perspective, and this is what the research is looking at. But time and time again, and all the current research coming out around diet and the microbiome, it's not looking at organic versus not. It's
Yeah.
looking at the types of foods we're choosing and how we're feeding our microbes, right? So it's not about, feeding the gut, you're feeding your whole body. And so I always want to say that because diet to me is kind of one of the easiest things that we can start to make some of those substitutions and changes that has probably one of the most profound impacts on your gut health.
Yeah. And I bring that up not to create more stress and fear in somebody's life, but I agree with you. There's a lot of food fear going on. Like,
Yeah.
I can only eat this. I can only eat that. I can
Right.
only eat this. Like, it has to be organic. Like,
Yeah, no.
you don't have any proof. And
Yeah.
somebody said to me, well, I know if it's organic, it's better for me. I'm like, you don't know that that's organic. They're
Yep.
like, yes, I do, because it's in the organic section. That is such BS. Just because there's a sticker on it or it's in that section,
And
I
and
know people in the industry are like, when we don't
same.
have
Yeah.
organic,
Yeah.
sticker, right?
Yeah.
And
Yeah.
you'd be like, well, that's not right. And they're like, nobody knows.
And also, like, I once was talking to a farmer. This was way back. I was living in central coast of California, and so it was a big strawberry area. This is where I did some of my training. And I remember I was working in the hospital, and I was speaking to this strawberry farmer, and he's like, strawberries have taken a hit. I created this sort of organic strawberry plot. It goes through, it takes a certain amount of years to change the soil, but then other areas surrounding, we're not. And what do you do when you water and there's irrigation? And so that's why I've always said, like, if it makes you feel better, like, we can use the sort of, clean 15, dirty dozen lists.
Mm-hmm.
But ultimately, I care about the types of foods you're choosing, the quality of your foods. And probably, in my opinion, one of the biggest things is reducing the number of preservatives. I think that is, the term processed foods gets thrown around. Pretty much everything we eat is processed, but it's those emulsifiers, it's those additives, and especially the combinations of those
Mm-hmm.
that we're seeing drive microbiome dysfunction, but more so even metabolic health and other areas of health. And so that's kind of what I teach. And there's a stepwise process because ultimately I want people to be on the diet that makes them feel the best.
Mm-hmm.
And so if there are people who can't consume, say, enough fiber or enough prebiotic fiber, then we have really good quality supplements as a way to people who can't consume enough protein for whatever reason. Great. We've got protein, drinks and things of good quality now that we can do. And that's where I think of the word supplement. And I used to tell, providers and patients this. The term supplement has two definitions. You can replace things that are missing in the diet because we can't get it, vitamin D, right? Things that we just don't get sufficient amounts of, or we're taking a supplement to achieve therapeutic or higher levels that we're trying to get, a different function from. And so I think no matter what we do, we work on the diet to the best of our ability, to what you feel you can do. And because if it's not sustainable, then it doesn't mean anything, right?
Yeah.
It's the long-term impact of diet that we really want to focus on.
And because we don't know everything, and because we know food changes a lot of different things, I think that foundationally, I say this all the time, I have it in my book, like, for me, a whole food based diet is probably the best place to be. Minimal amount of ingredients on it. Try and eat locally and seasonally as much as you can, because it's
Yep.
like less likely that that pepper that you got from the farmer down the street was probably grown in that farm. It's not grown some 2 countries away and
Yep.
then force ripened somewhere, right? Where it potentially, that's the whole argument against plants, is that they're more toxic. Well, I don't think when they're at their ripened state, they're at their most toxic level. There's a little bit of anti-nutrients in there that are needed for healthy gut function. But I think for most people, you know, when you're struggling with chronic health issues, and is just get back to the basics: whole food based diet,
Yep.
plants, fruit. Yes, meat is good and it's okay, right?
Absolutely. I mean,
Fish, all these things and lots of variety, but whole food based.
and variety, I think, is key. I
Mhm,
think, and that's one of the hardest things. I have like a thing on my refrigerator, especially because I have a 3-year-old who I'm, trying
mhm,
to get to eat lots of variety. But I think about like, can I add 5 new types of fiber this week, before I do my grocery shop? Like I kind of gamify things to be like, how can
mhm,
I create more diversity? Because we get stuck in our rut. And the other point I want to make too with diet is there's also diets out there that we use, restrictive diets, elimination diets, because we are so symptomatic. Um, and those can be beneficial in the short term. So I'll use like the FODMAP diet, which is a
mhm,
very well-known diet. It's been studied, it's clinically backed. I've used it with patients. These are fermentable carbohydrates, and essentially, fermentation creates gas, creates bloating. And so for people that have this imbalance, that have this sort of dysfunctional gut, removing those foods can actually relieve their symptoms. But long-term use of those of specifically a FODMAP diet has been shown to decrease the diversity and start to create more damage in the gut microbiome. So I think it's just this, there's almost like different aspects of sort of the food fear, but diet ultimately is the thing that's going to improve it, although we might have to take certain steps and stages to get to that diverse diet. So I think that's why it's so important to work with functional practitioners, people who are knowledgeable on this, because like I would have people come to me that are eating 2 things and still symptomatic. And it is then much harder to start to increase that diversity. It takes a lot longer
mhm.
and a lot more work to do that.
Yeah, I think that's fair. So, I'm not saying that any of these dietary strategies, carnivore, keto, vegan, vegetarian, paleo, AIP, that they can't change somebody's physiology. I agree. These are tools to help create a change, especially a quick change in somebody that may give them some symptomatic relief. But I don't think that any of those are great long-term
No, not at
strategies.
all.
I think you can use them as a tool, then start reintroducing, and you
Yep.
want to be whole food based, lots as much variety as you can, and potentially eating seasonally if possible.
Yep.
Um, how do we how does somebody realize that they have a problem with their microbiome, and then we'll jump back into that, like how do we evaluate it,
Yep.
because I don't think we answered that one before.
Nope.
So what might be indications to somebody that they have a imbalance or a problem with their microbiome, and not like somebody would say, well, I don't have a problem with my microbiome, I don't even know what it is, I just have reflux. I don't have a problem
Yeah.
with my microbiome, I just have irritable bowel syndrome. I don't have a
Yep.
problem with my microbiome, I just have
Eczema.
colitis, eczema, right? So
So,
what
yeah.
are the indications that somebody might have problems with their microbiome?
Well, I think you just kind of hit the nail on the head. It's not just about digestion, although digestive distress, bloating, gas, changes to your bowel movements, right? Constipation, diarrhea are oftentimes those first signals that something is wrong, something's changed, something's imbalanced within the gut microbiome. But that's not always the case. I have so many people that are like, I have a, stomach of steel and my gut's amazing, but they can't sleep. They're dealing with maybe
Chronic back
thyroid,
pain,
yeah,
chronic
thyroid,
leg pain,
or even thyroid
or
issues,
thyroid issues. Yep.
or skin issues or sleep
Depression.
disturbance. Exactly. And I think that goes back to sort of this gut X axis, is that the microbiome is seen as foundational to every system of the body,
Hmm.
but you don't have to have gut distress, you don't have to have gut dysfunction to have a microbiome problem.
You don't have to perceive,
Right.
right? I would say you don't have to perceive it, right? And I
True.
think that's a huge issue, because people are like, but I don't have any GI pain. Even celiac patients rarely have GI based symptoms. I think the statistics, less than like 30% of the people who get diagnosed with celiac disease actually go in with a complaint. It's usually because their family member got diagnosed and now they're testing the rest and they're like, oh, you have celiac.
Oh yeah, I experience that all the time. Even my niece, she has celiac, and oftentimes, especially in autoimmunity, we see this even in, thyroid autoimmune issues, that you will have other signs and symptoms start to pop up because your immune system's starting to kind of like alert all these signals. But my niece had like early signs of like all her teeth were cavities as a kid, and she
Mm-hmm.
didn't get diagnosed until she was 6 years old. She was, yeah, about 8 years old actually. Um, so she had some of these sort of early signs, extreme anxiety, as a young child,
Mm-hmm.
um, that were all before, and actually her GI symptoms were the very last thing. That was finally when, like, they believed me. That was like, you got to take her in to get
Mm-hmm.
her because their mom has celiac. But yeah, oftentimes we will get a lot of these, sort of other changes prior to even the diagnosis of some of these autoimmune conditions. So I think that's really fascinating. It's why, your history, your genetics are important to know that, because
Mm-hmm.
again, that can be that kind of like, hey, I've got a history of this. So when I start to experience something that's off, let's go down that, especially in the autoimmune space. But yeah, a lot of people I've worked with, even like just think of metabolic disorder, right? Obesity and diabetes and fatty liver disease. These are all rooted back to dysfunction in the gut microbiome. I
Yeah.
think about like, patients that are like doing things right and exercising and eating well, but not seeing the changes that they should. I think of the microbiome then.
Yeah. I think almost everybody that comes to see me evaluating their GI physiology is critically important
Yeah,
because
I
everything
agree.
has to go in through there. Everything has to go out through there. So you bring everything in. If it's not functioning well, you're not getting the micronutrients. If you're not bringing the right stuff in, it can create inflammation and immune activation, inflammatory signals. It can trigger problems with neurotransmitter physiology. It's so important. And you can't detox through a GI tract that's not healthy appropriately. So
Oh,
it is so important that for the listener, it really wouldn't matter to me what your diagnosis are or what your symptoms are. In most cases, it's one of the first places I'm thinking about as a problem, especially for the
yeah,
people who have immune driven disorders already.
yeah,
And we could talk about the impact of that, especially from a thyroid perspective of how that is. But it is, it's like, to me, it's some of the first things we got to think about. I have migraines. Okay, we got to consider what might be going on in your gut. Well, no. I have a hormone issue. Okay, but we still need to be considering what might be going on in your GI tract. But I don't have any GI symptoms, but that doesn't mean you don't have a
yep,
GI problem, right? So,
yep.
and they may say, well, I've been checked and I don't have a gut-based issue. Tell me who checked you. I went to see this gastroenterologist and they said, I don't have Crohn's colitis. You don't have pathology, but you have dysfunction. And the tests they ran are pathology-based tests. They do pathology-based care. We do functional-based tests and try to restore function so you don't have the pathology. So it's different. Yes, you can still have a GI dysfunction without a
Right,
pathology, right? You
right.
can have uh, chaos in your neighborhood without people shooting each other, right?
Yep,
It
yep.
could just be arguments, right? And tension.
Absolutely. And I think to each practitioner themselves, but for me, and obviously I worked in GI, but for me, the microbiome was that place to start, because oftentimes if you can start to build resilience and start to improve that resiliency, you will see some of those other symptoms. So I, instead of like chasing the symptom, I start with the foundation and then see what needs improving, upstream from there, from, detoxification to, everything else, right? Digestion to brain health. And I think that's where, kind of bringing it back to the research, it's really exciting to see how the gut is connected to the brain, how the gut's connected to the thyroid, and vice versa, right? We have these axes. It's this bidirectional communication where
Mm-hmm.
one thing that's off, say in the brain, say chronic anxiety or chronic depression and anxiety, can drive gut dysbiosis. Same thing, right? Loss of thyroid function can drive gut dysbiosis, but dysbiosis and changes in the gut can also drive dysfunction to these specific organ systems. And so for me, I would take a lot of these complicated patients that I'm like, oh my goodness, you've got polypharmacy, you're on a million drugs, you're taking a million supplements, you've seen every practitioner. Like for me, that first place was always the microbiome. And that was just me as the practitioner, because I
Yeah.
knew there was a lot we can do, and you can actually create some real clinical meaningfulness with even some small changes.
Right. So diet's important, reducing
Yep.
the overall stress load. And when we talk about stress, we're not talking just about emotional stress
No.
and mindset. We're talking about sleep disruption can create
Yep.
challenges. We can talk about um, poor respiration and how
Hmm.
that alters and affects our physiology. We could talk about, we talked about food, alcohol, We can also consider, we talked about medications, how they can have an impact, but even things that people think they're doing really well.
Yeah,
Like
I was just about
I
to say.
exercise every
Yes.
day, right? And I'm like,
Yes.
I can't tell you how many endurance athletes you see that have chronic
Yeah.
GI issues.
I see
And
it. I saw that all the time, especially here in Colorado. I worked with a lot of sort of ultra marathoners and
mhm,
ultra athletes. I think, like everything, and I say this about the diet, it's probably one of the hardest things to talk about. And the microbiome is very much like this. It's the Goldilocks.
mhm,
It's all about balance. And I mean, I would work with patients that were just diagnosed with, say, IBD, like Crohn's or colitis, and running was their outlet, and running was their thing that helped them sort of mentally feel better, but it was actually driving a lot of chronic physiological stress. And we know when it comes to, this is another sort of really interesting and big area of research, is sort of this athlete microbiome. We see a lot of elite athletes that have, like you mentioned, gastrointestinal disorder. They call it EGIGs, right? Like there's a term for everything, but
yeah,
basically sort of IBS
mhm,
associated. And it's because longer duration, greater intensity actually drives intestinal permeability, starts to knock out your fence posts. And that's where then, bacteria and bacterial components can start to drive inflammation and immune activation. So I really say, like, exercise is important. There's kind of this like sweet spot of like what's the right amount of exercise versus overdoing it. And I think that can be personalized. I think we underestimate the power of walking and how
mhm,
incredible that is. But yeah, I mean, and they've done now microbiome assays to look at, sort of the the everyday exerciser compared to the elite athlete, and they truly do have a dysfunctional microbiome analysis. They don't have the right types of bacteria there. They have this broken down barrier. And so um, balance is key. And what makes you happy and brings you enjoyment might not always be the best thing, but how can we lessen it or change it where you're still getting that same satisfaction?
yeah. I think we kind of think of health sometimes by the look, right?
Yeah.
We look at the individual and they're physically fit and jacked, and we assume that their body is actually healthy, but we don't understand what it took to get that way. We see the ultra endurance athlete or triathlete and assume that because they can do this masterful thing from a physical fitness standpoint, that they have great metabolic fitness or healthy microbiome, and that may be very far from the truth. You often see elite athletes getting by, but really, really unhealthy
Oh yeah.
people, and um, especially in the situation where you have athletes in the fight world or wrestling world where
Oh
they
yeah.
are training hard and then have to cut weight massively to make a certain weight, and the distress it creates on their whole physiology, but for sure on their overall gut physiology. So
Oh,
it's not about the look. It's kind of like Instagram. Like everything looks beautiful and crazy. Look at that. That's awesome. But you don't see what's really going on behind the scenes.
yeah.
And many times those people who post these fantastic, everything in their life is fantastic, are probably the people who are just getting ready to go through a divorce or, doing something else that's negative. So let's
I
talk
think that's
about,
why I stay away from social
yeah,
media
right. Yeah.
sometimes. You're like, gotta take those rose-colored glasses off.
Yeah.
Yeah.
It's not a great place to live. Let's talk about evaluation.
Yeah.
So there's lots of tests on the market. There's tests patients can order from home. There's tests that just measure the microbiome. There's tests that have a functional capacity to it, like digestive capacity,
Mhm.
intestinal permeability markers, indicators of short chain fatty acid production. So do we have a good idea, a good sense of the best way to measure the microbiome? And
Great
what are those
question.
types? And
Yeah.
what types of tests would those be?
Yeah, great question. There's a lot of options out there now, and like advancements in cell phone technology, we have advancements in microbiome technology. And I think microbiome testing, I will say, it's data, right? They're complicated. I think as a practitioner, you need to go through training to understand the nuances. I think, unfortunately, a lot of microbiome testing is treated very similarly to traditional diagnostic testing. You don't have this, replace this, or you have this, let's kill this. I call it the point and shoot method. It's much more complicated than that, right?
Yeah. It's like genetic testing, right? Like,
Yes.
oh, you have this MTHFR, you need folate and B12, right? Methylated folate, and
Yeah.
maybe you don't.
Yes.
Yeah.
Not genetics is a whole nother area, very
Yeah.
complicated.
Yeah.
But yes, I think it's a data point, right? And I think what I love about microbiome testing is that it can really give a baseline sort of snapshot. Now, yes, you can do a microbiome test one day and another day and it looks slightly different, but it does give you a baseline understanding of what's going on in the microbiome.
Mm-hmm.
How much of the, do you've got the neighbors in there that you want to live next door to, or do you have some of those neighbors that you're like, I wish you'd move out, right?
Mm-hmm.
And there is more advanced technology, what's known as whole genome sequencing or shotgun metabolomics, where it looks deeper and can actually look at the entire genome of bacteria, meaning you can see deeper into who's there, so down to sort of that species strain, and I'll explain what that is in a second. But you can also see what they're doing. And so when it comes to bacteria, and we see this in the probiotic space especially, you can take a very healthy bacteria, let's say Lactobacillus acidophilus, right? Like that's a species, so you'll take that, but when you get to that strain level, Lactobacillus acidophilus LA5, for an example, right? You're better able to determine that specific function. So the analogy I use is think of like dogs, right? They all come from the same genus, from the same family, and then you have your terriers, you've got your pit bulls, you've got your chihuahuas, right? Mm-hmm. They act different, they look different, or even Homo sapiens, right? We're all Homo sapiens, but we are very different. So we are our own individual strain, right?
The analogy I use is like, it's like if somebody told me they married Joe Smith. Okay, which one? That's like, I'm taking Lactobacillus acidophilus. Okay, yeah, but which one? Like,
and that is like, I think one of the biggest areas of like sort of myth and conversation, especially in the probiotic space, is you cannot extrapolate research on, say, a Chihuahua and transfer that to the pit bull. They're very different. Mm-hmm. And so whole genome sequencing, or this sort of shotgun sequencing, because they can look at the entire genome or the entire DNA of a bacteria, you can get more specific down to that strain level. There are various companies out there that are using that type of technology. And beyond that, beyond just seeing who is in the microbiome, what kind of neighbors you have in your neighborhood, you can see what they're doing. And that is another sort of complicated piece. But when we look at the functions, are we producing enough, say, short chain fatty acids, these metabolites, bile acids? Do you have the right people there that are converting your primary bile acids to secondary bile acids, tryptophan, metabolites, all these things that we consume that our bacteria will actually break down? Are they doing that the way they should? And that's really, when we look at the microbiome, it's that functional redundancy and capacity that actually dictates a lot of the health of the microbiome. You can have lots of bacteria there, but are they not consuming the nutrients the way they should and producing those compounds that we know are beneficial?
So I think that's the challenge with some of these direct-to-consumer tests. They have the organisms there, and then say, oh, because you have these organisms, or you have a reduction in these organisms, therefore you're going to have normal short chain fatty acid production, or you're not going to have normal short chain fatty acid production. And that may not be true, what they come up with as a conclusion. Like, you have these bacteria, so you could do this, or you shouldn't do this. But when you run some of and these are tests for the listener, you can run microbiome tests that are connected to functional assessments as well. And you can look at both, because you might just look at the microbiome and say, oh, because these species are low, because you have low bifidobacteria, you're going to have low short chain fatty acids. And so you may make an assumption, but if you had a test that had both the microbiome and the functional markers, then you might look at it, okay, yeah, I have normal Roseburia, I have normal bifidobacteria, but I still have low short chain fatty acids, right? So I think these direct-to-consumer tests that don't have that additional functional marker test, they can provide some information, but I don't think it's really in the best benefit of most patients for those. And you may have a different opinion on it, because it makes some decisions to me. And yes, genetic testing is a whole nother can of worms, but it's the same thing from a genetic standpoint. When somebody gets a genetic report from somebody and because you have this gene, you need this supplement, because you have this gene, you need that supplement. When you really read through what they say, they're contradicting themselves all the way through this genetic report, right? Just because you have a gene polymorphism doesn't necessarily you need a whole bunch of cofactors. And just because you don't have a gene polymorphism doesn't mean you don't have dysfunction with that gene. So there's direct to consumer, there's typically the functional clinician kind of focused functional stool test. Where do you see a role for both of those? Am I totally off base in what I'm saying from your opinion?
So, and one thing I just really want to mention too, especially to the consumer, we can't diagnose based on microbes.
Mm-hmm.
You're looking at patterns, you're looking at kind of an overview, but you also have to think about, well, what am I eating? What am I taking? What are all these other things going on in my life that could impact the microbiome? So as a practitioner who I do lots of stool testing, I do lots of microbiome analysis, we can get a sense of things like digestive capacity. Do you have sufficient, stomach acid? What do we have to do to create interventions from diet to lifestyle to supplements to start to shift your microbiome into a more resilient state? And so I think, in my opinion, like I struggle with some of the direct to consumer labs because they can be misinterpreted.
Yeah.
This is much more complicated. This is much more nuanced, and which is why I think there are incredible companies out there that have incredible resources for practitioners. I think these are tests that should be geared towards practitioners because we know how to interpret it and then to create a plan. Because like I said, it's not point and shoot.
Mm-hmm.
It's not so binary, right?
Mm-hmm.
And I think that that's what's hard, and it is a snapshot. So I personally use lots of stool testing in my practice. It's sometimes where I start because it can just give me an idea of how dysbiotic, especially if we've got lots of pathogenic bacteria, proteobacteria, these bacteria that we know contain certain components like lipopolysaccharides, which are sort of these endotoxins that are contained on our gram-negative bacteria that can, if you have intestinal permeability, can begin to wreak havoc and start to drive inflammation to these various organ systems. We have supplements, we've got strategies that we can help bind those or remove those. So I think stool testing can give us a direction and can also give us insight into potentially further testing. If you have certain consortium of bacteria that may be more predominant or prevalent, say, in IBD, and you're experiencing GI symptoms and you haven't seen a GI doctor yet, well, hey, maybe you do need to go get scoped because you've got a high amount of, say, this fusobacterium that we know is extremely inflammatory. So I think it's its own field. And I say that wholeheartedly, as someone who's spent a lot of time in this, that you can use these tests in an extremely valuable way. And then we can also use them where maybe it gives some diet influence or gives some supplement influence, and it's just not as simple as that, right?
Yeah, I think what happens is that people get the direct to consumer tests, and even maybe some clinicians do the same thing, and they see something like these keystone species. Let's use Akkermansia municipilia, like it's low, so I need to give Akkermansia, right? And now there's a probiotic. Or the bifidobacteria is low, so I need to give bifidobacteria. Or lactobacillus is low, so I'm going to give lactobacillus, and that becomes a strategy. And what I think you and I would both probably agree on is the microbiome gives us a sense of maybe we've got problems, but the bacteria that's growing or not growing is a result of what's happening with the terrain. Yeah. Like your life, your lifestyle, what you're putting in there, the amount of inflammation, the type of food you're putting in determines what grows there. And so it's not as simple as, oh, I don't have low lactobacillus or low Akkermansia, so I'll just take that as a probiotic and that's going to fix it. That is a patch strategy that may not have the impact that you want, because just because you put those bacteria in there as a supplement doesn't mean that they're going to colonize the tissue and it's going to change the terrain the way we want it to, right?
Right. And I think that's the important thing to understand. And for many clinicians too, is shifting this mindset of like probiotics are really targeted. It's like medicine. They're targeted to what you're trying to improve and support because there's dysfunction taking place. So I'll give an example. I work for a company, Resbiotic, and we have a lung probiotic. Really fascinating, especially because sort of the lung microbiome area is more newer it wasn't even part of the Human Microbiome Project. We thought the lungs were sterile. They're
Hmm.
not. But if you have let's say, you have a dysfunctional gut microbiome, and this is potentially driving changes to the lungs, reduced lung function testing capacity, we've identified and we've studied specific respiratory benefiting strains that can help support the production of short chain fatty acids. And through this modulation of the microbiome, improve the functional capacity or output in, say, the lungs. And I think that that's how we have to think of probiotics. And that's really how we have to think of some of this support is it's targeted.
Hmm.
I think, in my honest opinion, truly gone are the days of sort of this all-in-one general probiotic. I think we have the ability to study strains intimately and intricately to understand their function and create very powerful and efficacious products that target those very specific needs. And I truly think, because they're not colonizing, they're not seeding the gut. In fact, there's a lot of researchers, big researchers out there that are trying to understand why certain bacteria will colonize in, say, one person's microbiome and not another's. Of course, the terrain being the biggest
Hmm.
influence of that, your diet and all this. But even those things aside, like, why can you see, say, something like Akkermansia colonize in one person and not the other?
Right.
We don't have that knowledge yet. We don't have. I mean, maybe some people do, and they're doing the studies to try to show that, but we don't. I mean, we've done human clinical trials on our lung probiotic, and we saw those strains stick around, but that was only for a certain period of time. At what point then do they start to disappear? And I think that that's just the movement we're going to see. We know there are various strains that are targeted toward antibiotic-associated diarrhea, whereas you might take them then for lung health and they don't do anything,
Yeah.
right?
So I think that's important. So I just want to reemphasize it. It doesn't mean that a probiotic can't be beneficial for you. So the person who's going, hey, I took this probiotic and my gas is better. I took my
Yeah.
probiotic and I don't have loose stools anymore. I'm not saying that. You're not saying that. What we're saying is it's typically not a long-term health strategy just to say the only thing I need to do. If you take a probiotic and it creates some positive change, and I use probiotics, you use probiotics to create change, it's many times in an effort as a temporary solution while we're addressing the other things, right? Hey, you don't have a fiber rich diet. And so, yes, let's get some fiber in the system. Let's support the growth of the bacteria, maybe use some of these short chain producing probiotics with the fiber to see if we can create the changes we want temporarily while we continue to work on the terrain and make it healthier for these things to grow. So let's kind of dive into how the microbiome has an impact on the intestinal health overall, and how problems in the microbiome and maybe what some of those mechanisms are that might trigger thyroid dysregulation, immune dysregulation, and thyroiditis,
Hmm.
Hashimoto's,
Yeah.
and other immune conditions. How do we see this happening? Because some people are like, I don't understand the connection from my gut to my hypothyroid condition. So how would you explain how that might occur?
And it's very complicated, right? And
Hmm.
it's also really fascinating because we are seeing components from the gut show up in other areas of the body. So basically what's happening, we talked about sort of these characteristics of a healthy microbiome. We start to lose diversity, and specifically we lose diversity of these probiotic species within the gut microbiome. And that, probiotics, these lactobacillus and bifidostrains, they bring acidity, which is how the environment that they like, and your bad bugs or those neighbors you don't want to live next to, they lower that pH. And so it creates a much more alkaline environment, which is more friendly to those pathogenic bacteria. So as you start to lose those species and we create more pathogens, more unhealthy bacteria, that's one of the first things that starts to degrade or break down that mucosal barrier, starts to knock out those fence posts, because we're losing those constituents that are there to help maintain that, especially when it comes to things like the production of short chain fatty acids, which we know is very important. Butyrate being, that primary source of fuel for your colonocytes, supports the gut barrier. So as you lose these species, We know that there are certain types of bacteria or certain types of I mentioned earlier, these endotoxins, lipopolysaccharides that, are sort of waste products, are on what's known as gram-negative bacteria, which is the predominant type of bacteria. And I think we mentioned this before in our non-recorded podcast. Right. LPS, I think, gets used interestingly in the conversation, but LPS in a sort of healthy microbiome is normal. It's there, right? And I think there are certain LPSs on certain types of gram-negative bacteria that are less have less, immune activation or immune impacting characteristics. Mm-hmm. But ultimately, if your fence post is getting knocked out, and you have lots of those LPSs, especially those that are coming from more of that pathogenic bacteria, then it gets into systemic circulation and now can travel via all different highways in the body, right? We have our vagus nerve, we've got our thoracic duct, we've got our get into bloodstream and essentially drive inflammatory responses to really start to cascade. So LPS into systemic circulation can now show up in various parts of the body. We see this connected to thyroid dysfunction. We now see this connected to things like Alzheimer's. They've done autopsies, they've done studies to show that there are high amounts of LPS in certain areas of the brain. We see this in the liver. We see this in the lungs. And this is a big part of, and the reason is because LPS will bind to our immune cells and essentially get escorted. There's, LPS taxis that are known as LBP, but they're LPS taxis that will deliver LPS to these specific immune complexes. You've mentioned them, the TLR4 complexes that essentially turn on inflammation. So you start getting this high production of inflammatory cytokines, inflammatory signals like interleukin-6, TNF alpha. And then this is essentially what starts to be the driver behind low-grade chronic inflammation. And there's been numerous studies in humans and animals beyond. I mean, one of my favorite studies was actually done in 2007. So kind of at the start of the Human Microbiome Project by the American Diabetes Association, a very conventional group, right, might I say, that looked at, does, chicken or egg, is it the gut that's driving, obesity and insulin resistance, or is it the obesity and insulin resistance that's driving? And they actually found that the triggering, the trigger of it all was LPS. And this was done very early on. So this has just kind of catapulted the research around lipopolysaccharides. And so that's kind of the sort of main mechanism. It's twofold. You have the reduction of the beneficial components, short chain fatty acids, and you have a higher production or a higher amount of these endotoxins that has, creates sort of this immune activation and inflammation to take place. And this can be in various parts of the body. Now, it's unknown, like, oh, you have high LPS and you have gut dysfunction, so it's going to go to your brain first. No, of course not. But that's really one of the drivers between like how gut dysfunction can drive sort of thyroiditis, and then it's reversed. So a lot of the conversation or communication happens majority from gut to organ system. So we know like even gut to brain is 90% of the signaling. But let's say you are someone who has autoimmune thyroid disease, Graves or hypothyroidism, or you have COPD or asthma, that these sort of chronic inflammatory conditions is also a driver of intestinal permeability, also drives dysfunction to the gut. So it's bidirectional. And we see that, and we know that 70% of our immune system is contained in the GI tract. So once you start to see that breakdown and have that breakdown in the mucosal barrier, in the integrity of the gut, that you start to change those immune responses that are taking place. And essentially, your immune system can't determine what's friend or foe, and it just starts sending out all these smoke signals to all aspects of the body, which is why when you have autoimmune conditions or you have depression, you often have other symptoms. Even in the lung space, asthma looks similarly from a gut perspective to IBD. And we see a lot of similar symptoms coming up from, people that have, say, thyroid conditions and then also have GI issues, right? So that's kind of that other downstream impact.
Yeah. Yeah, critical. I mean, the right type of bacteria helps produce the short chain fatty acids that help regulate the tight junctions. And that's critical because as the tight junctions break down, more food particulate, more of these lipopolysaccharides, other components of bacteria can move in. And you said pathogenic, and I want to make sure we clarify that a little bit.
Yep.
It doesn't have to be pathogenic bacteria that shouldn't be in the GI. This could be your commensal bacteria, the bacteria that should live in the GI tract, but because particulate or the organisms are leaving the GI tract and getting into a part of the body where they're not normally seen, that can trigger the immune and inflammatory process. Another thing that's really important is how your gut bacteria and your gut flora influence your bile acid physiology. And when we don't have appropriate bile physiology, that also can have an impact on the tight junctions, and it can have an impact on the immune system of the GI tract, because bile acids are direct antimicrobials at the top end of the GI tract, and they're indirect at the bottom end of the GI tract. And the other component, and I think you already alluded to this, is that, organisms can translocate, and some of these things, toxins can translocate, and it's not just bloodstream, but the lymph tissue and other mechanisms. And there has been some discussion about the direct lymph connection from the gut to the thyroid, which I think is really, really interesting, because now you go, and it's been my argument that I don't think thyroid physiology is oftentimes broken as the real reason it's starting. I think it's an adaptive response to infection, cell stress, and all these other things. I want to ask about this point because this is something that I hear, and I see both sides of it. But there's this discussion on leaky gut or intestinal permeability and how it's best identified. Is it zonulin in the stool? Is it antibodies to zonulin? What does the literature say is the best way? Because for the listener, we can measure. I'll let you do it. You're the guest. I'll let you discuss what zonulin is, why it's important, and how we use zonulin as an indicator of intestinal permeability, or what we call leaky gut.
So there's a lot of conversation when it comes to zonulin. And so basically it's a protein, right, that's related to the tight junctions and the permeability between the tight junctions. And there are definitely, and I think if you talk to like different lab companies and this, that will have varying opinion. It has a short half-life, so sometimes it's not always the most indicative marker in stool. It's one thing that you can look at that could potentially be elevated, that could get indication. But this is why I think it's also important to look at the other components of what we know creates a dysfunctional gut barrier, right? Loss of keystone species, loss of beneficial bacteria, high amounts of, say, proteobacteria or pathogenic bacteria or opportunistic bacteria that we know contain lots of those gram negatives. So I think it's one marker that can, when it's chronically elevated, potentially indicate increased intestinal permeability, but you've got to look at the whole system. And that's why, like, it goes back to what we were talking about with testing, is even things like calprotectin or secretory IgA, they're happening as a result of the bacteria and what they are or are not doing. And so you can't just look at that and say, oh, you have intestinal permeability. You have to look at that zonulin and say, okay, who else is there? Who's not there? Are they doing what they're supposed to do? What are you feeding the bacteria? And then create kind of this understanding of, well, yes, it looks like you probably have intestinal permeability. And so I think that's why we use sometimes these stool chem markers as just that sort of first light or first sign that something's wrong or not right. But we have to double click into it to really understand what's driving those changes. And is this something that's chronically happening, or is this a reflection of something more acute, right? But the truth be told, like when you look at some of the statistics, and I'm going to butcher this because I can't really remember, but I think it was something like 80% of people have intestinal permeability. And it's the chronic intestinal permeability. It's the long-standing dysfunction to the microbiome that we start to see. And so much of the interventions that we do and the dietary changes is to build resiliency, to, like you mentioned, to shift the terrain so that 80-20, right? You're doing the right things, but 20% of the things that you're not doing, the alcohol, the diet stuff, it's not going to impact you. And I think that that's the biggest goal. But yeah, I think when it comes to zonulin, you can't just take it as this gospel that there's, right? It could also be just a what type of inflammation. So again, you've got to look at the bigger picture to really, I think, get a sense of intestinal permeability.
Yeah. So for the listener, some people, if you get a stool test, a lot of stool tests will have fecal zonulin on there. Just because it's normal doesn't, in my opinion, mean you don't have permeability.
Right.
Okay.
Right.
If it's elevated, it usually indicates this is a peptide protein that's breaking down and showing up in the stool. If there's damage to those intestinal junctions, you're going to have more of it probably showing up in the stool. Okay. Regardless of whether we call it permeability or not, the likelihood that you're going to have really high levels and not have damage to those tight junctions is probably less, right? So if there's higher levels in there, probably a good indication, especially if there's highs or lows of secretory IgA, other inflammatory markers. I know people like to hang their hat. Well, I have leaky gut. Okay. That's another thing where somebody hangs their hat on a diagnosis, and you're correct. I think everybody's got a level of permeability. I kind of think about the intestinal lining like a screen in my window, right? Teeny tiny little holes to let air in, but keep all the bugs out. And it's not whether I have permeability or don't have permeability, but the level of permeability. So yes, we could look at the zonulin and say, hey, there's really high levels here. There's probably more intestinal barrier breakdown. We can also look at it in the blood and look for antibodies for zonulin. And that may have a bigger indication when we see it, that meaning, hey, we're getting, the immune system is making antibodies to this. So there's likelihood there, again, more likelihood of breakdown. Maybe some of those, the immune system is sensing some of those, that DAMPs, what we call damage associated molecular peptides, showing up and making antibodies as a result. Whether it's actually creating the damage or it's the cleanup crew is yet to maybe be fully decided. But it does have bigger implications sometimes when we look at antibody mediated response. We definitely would think about the gut and the GI tract as a major source of where that barrier breakdown's occurring. But we have other tight junctions that could also be being broken down, right?
But if you look at that, and you have those antibodies in the blood, and you see high zonulin on the stool test, and you see all this opportunistic gram-negative pathogenic bacteria, you have reduced short-chain fatty acids production, then you can, and someone's experiencing all these symptoms, then you can most likely say that they're dealing with intestinal permeability, chronic inflammation, and we have to start to support that. And so that's why I say I don't think there's like a go-to test. It's looking at the consortium of everything, symptoms, what we're doing, right?
Yeah, and we really don't need the test to convince somebody. We just need, hey, you got chronic signs and symptoms, you got dysfunction. Let's start making some changes here. I think the reason I like running these functional stool tests is to help the person understand why it's so important. Hey, look, I know you think you eat a healthy diet. Let me show you what's going on here. You have a problem, even though you're taking that expensive that probiotic, you still have dysbiosis. It's not doing what you think you're taking lots of Akkermansia. Your Akkermansia is still low. You've been taking it how long? 2 years. Yeah, it's not doing what you think it's doing. You still, you say you have a perfect diet and lifestyle, and you still have tons of GI inflammation. So something's going on here. Your pancreatic enzymes are insufficient. So yes, the digestive enzyme you're taking is probably beneficial, but we should be asking why. It's not fixing the reason, like you have reduced pancreatic output. We need to consider, is there low T4 to T3, and that's impacting the sphincter of Oddi? Is it because you have excessive amounts of estrogen that are causing that sphincter of Oddi to not relax and let digestive enzymes and bile flow in there? So it gives us more data for the individual to say, why do I have to change my diet? Here's the reason this healthy diet and lifestyle you think you're doing needs to change somehow.
That's it. And I 100% agree. And I even I would consult with practitioners and I'd say, don't tell me about the patient. Let me see if I can look at the stool tests and get a sense of what's going on with them. And oftentimes you can, from a symptom standpoint, because of the types of bacteria there, who's not there. and what they're not or may not be doing. But I think it helps from a patient standpoint to say, hey, you think you're doing something that's good for you, but we actually need to change it up and do something better because it's not working, because of the fact that you don't have these bacteria, because of the fact that, like from a thyroid's perspective, right? 20% of T4 to T3 conversion happens in the microbiome. Well, if you don't have this right balance, then those processes aren't happening, or even estrogen metabolism, right? Like if you have bacteria there that are basically putting those estrogens back into circulation, we can see that, and then we can start to get, I think, a little bit better picture clinically of how we then have to go about our interventions, from diet to lifestyle to supplements.
Yeah, I think it gives actionable data for
Yep.
change. I know I hear some loud voices in our industry saying these tests are no good, they're not helpful, they're not scientific, they're not all validated. Like, I get it. They're selling a product and they may not use them, but I would disagree with that in a lot of cases. I think it helps a patient understand why change is necessary and why well-intentioned strategies are probably not working, and helps for actionable stuff. I want to hit on one.
I think it can even help. I just want to say, I think it can even help for any clinician listening to figure out the hierarchy of where do you need to start. And so maybe we don't have to start this probiotic first, and we actually need to start with prebiotics and certain binders or certain digestive. So I think it can just kind of help lay the sort of path of like what you do, because we want to be mindful about that when we're working with patients,
especially when you start to really learn what all the individual markers mean versus just going off a protocol. Right?
Agree.
So let's touch on this because it's important. This is part of what you're involved in now, but there is the hot trend right now revolves around GLP-1 drugs and GLP-1 probiotics. Okay. Lots of companies coming out now that say, hey, if you just take my probiotic, it's going to help you lose weight. You'll lose 20 pounds in 4 months. And this is the secret. So let's talk about a little bit about GLP-1 in the time we have left. What is it? How is it generally made? What's maybe the influence of the gut biome? And why are so many people being put on GLP-1 medications? And what is the fact that everybody's trying to get these GLP-1s and they do seem to have a change? What does that tell us about that person's microbiome?
Yeah, I mean, I think it's such an important topic, and not to get on like, no, you shouldn't or shouldn't, but even in the thyroid sense, right? This is all connected. So, you've got someone who's struggling with weight or metabolic dysfunction. They're doing things right. They're on the right medications, let's say in the thyroid, in the hypothyroid realm. Most people don't realize that glucagon-like peptide 1, GLP-1, is produced in the GI tract. It's produced by your intestinal L cells. And it's heavily influenced by the microbial signals that are taking place. And this is why when we look at this sort of gut axis, metabolic concerns and metabolic issues are constantly being linked back to dysfunction in the gut microbiome. And we see this, and research is really, we have very compelling research around this. But the difference is the GLP-1 that we naturally produce rises and falls in response to food. And it has a very short half-life. So it's like you eat, you get this rise and it drops in 2 to 3 minutes. But we have GLP-1 receptors all over the body, brain, similar to thyroid receptors. And if you're not producing enough of that GLP-1 endogenously, naturally, then you're not getting that same signal to those receptors. So, hey, I'm full, or, the change to your blood sugar that you should if you're not producing enough of it alone, and or your own production of it. So I think when it comes to not even just probiotics or postbiotics, food and other herbal components have really shown what can help support that natural production. I've definitely been in the space of the microbiome space. I work for a company. We have a GLP-1 postbiotic. Postbiotics are actually, we used to think of them or still think of them as the sort of end product of fermentation, or butyrate, but they're actually heat treated or heat inactivated probiotics. And we know that when probiotics die, think of them as like ghost biotics, or parabiotics, they actually retain very specific function. And so the postbiotic we're using specifically supports modulation of the microbiome in producing and supporting that natural GLP-1 production. But it's not GLP-1. When you take a GLP-1 agonist, a medication, you are taking that natural hormone at 1,000 times the dose that your own body produces, which is why it's a once a week medication. So you're taking it at super physiological levels, which is why, and part of the reason for the success, these have been used forever. I've worked in diabetes, since back in 2010, they were being used, and it's just really gotten popularized for weight loss because GLP-1 naturally slows digestion. It signals fullness, right? It supports your blood sugar regulation. But we're taking it at much, much higher levels. And so when it comes to any of these sort of natural supplements and natural components, whether it's a probiotic or a postbiotic or an herbal component, you're not taking synthetic GLP-1. You are supporting your own body's production. And I do think, and I truly believe that for success in the metabolic space, whether or not you're on GLP-1 medications or not, you have to fix the root. And a large part of that is the microbiome. Short chain fatty acids, your prebiotics, right? We talked a lot about those fibers. That production of butyrate binds to specific receptors on your intestinal L cells to promote the production of GLP-1. We know most people are not eating sufficient amounts of fiber. 7% of Americans, in fact, are, and I would argue it's probably even lower, are eating sufficient amounts of fiber. And so it just all loops back to all these things that we've been talking about for the past hour of what's damaging the gut microbiome. But I do see some of these GLP-1 supporting products out there, and especially from a microbiome standpoint, as just being part of the toolbox. There's a lot of research going on now of like, what can you do to have more sustainable results? Because we know that a lot of weight regain occurs once you discontinue or stop taking the medications. Well, if you haven't fixed the microbiome, if you haven't gotten to the root of what's potentially driving imbalances to these natural metabolic processes, you're going to probably gain the weight back. So I think it's just part of the program. It's part of the plan. And there's been enough research now in the gastric bypass space, in the weight loss space to show that if you modulate and support the health of the microbiome, you build more resiliency in the gut microbiome, then you can have more long-term sustainable results.
Yeah. And I think one of the most important points is there that you said is we make GLP-1. So almost anybody who's overweight or obese and goes on a GLP-1 medication and they're like, hey, I'm losing weight. Yes, but you also, at the root of it, you probably have problems with your gut health, your gut flora, and you're probably not generating the natural amounts of GLP-1 to begin with. So I think that's the key point. I think some people believe that it's a drug that their body doesn't already make, and we already make it. But the fact that you're taking it and it helps is great, because what it does is it turns off the liver's production of glucose. So essentially, when you're eating, you're getting nutrition in. So GLP-1 is released by the GI tract to tell your pancreas, like, hey, let's shut down, and the liver and the pancreas, let's shut down.
We have these receptors
glucose
everywhere, similar to our thyroid. So there's miscommunication when your body's not producing enough, or these microbial signals are not strong enough to support that production. Then all those receptors aren't alerted. So each of these various processes can get disrupted.
Yeah. And so if you don't address the gut, the issue, the reason, what created the dysfunction of the terrain, what's creating the dysbiosis, and you just take the medication, you're going to lose some weight. But unless you're really working with somebody who knows what the heck they're doing with these medications, you may wind up skinnier, but potentially skinny fat with more muscle loss. You're leaner, you think you're in greater shape, but at the end of the day, you've got less muscle mass. So when you stop taking it, if you do, the likelihood and you start eating more because you won't have the suppressive effect of the GLP-1, now you have less muscle mass to burn it, and you probably still have a level of dysbiosis and dysfunction in your gut that you just have kicked that can down the road and still needs to be addressed.
I think everyone's always looking for that magic bullet. And I think GLP-1 medications are pretty incredible in what we are seeing them do and what some of the research is showing.
Mm-hmm.
But there's not a one size fits all model. You have to do it all. It doesn't mean you have to do everything perfect, but you have to work on the diet. You have to work on your physical activity. You have to lift weights. You have to work on your stress. And it's still part of a whole body plan, like most other medications too. And so I think we're seeing great results. We're seeing really incredible things, but you still have to put in the work. You still
Yeah.
have to do the things that are good for you if you want to have sustainable results.
Yeah, I think it goes back to what we were talking about maybe before, and it's a tool in
It's
the
a tool.
toolbox,
And
but it's not the tool. So if you're relying on this to be the only tool, you may be disappointed down the line somewhere. So Kara, we're at the end of our process. You probably got stuff to do. I got stuff to do. We actually recorded this one, so this one's going to go out ASAP because it was meant to be, I think, next Tuesday. So it's going to go out pretty quickly. Final comments from you. Where can people learn more about you and what you do? And any final comments?
yeah, no, I appreciate you having us on. And I think hopefully what listeners will take away is your microbiome is really it's kind of like the next frontier when it comes to overall health and improving health, whether it's your thyroid, whether it's your metabolic health. And there are really great tools from diet to supplements to medications, and they're all part of that toolbox, like you said. And so I work for a company called Resbiotic. We're a biotech company that's using our own strains, doing a lot of the preclinical work. I think when it comes to supplements, efficacy is important, and clinical research is really how you prove that and show that. So check us out at Resbiotic. We have a few various products. We have our GLP-1 postbiotic. We have a really cool prebiotic as well. You can find me on social media, Kara Siedman. Always happy to answer questions if anyone has.
Awesome. Well, I appreciate you coming on the Thyroid Answers
Yeah, thank you for
podcast.
having
I
me.
will let you get back to your life, and maybe we'll have you back on in the future to discuss
Awesome.
something else revolving the microbiome.
Love it. Thank you so much.